welcome back to my channel. It's your girl Nani back again with another video. I hope you guys are doing well today. Welcome to my channel if you're new here, and if you are not, thank you so much for clicking into today's video. Today's video is going to be about the downsides of studying medicine in Bulgaria, specifically MUV. The first downside of studying medicine right here in Bulgaria is that there is going to be a huge language barrier. So as an international medical student, you will be shocked that everything is in Bulgarian here, okay? Don't be fooled that you can finesse the streets of Bulgaria with just English for 6 years. Don't be fooled that you can finesse your medical education for 6 years by not knowing the basics in Bulgarian, not knowing how to express yourself a little bit, to take at least history or to say hello, okay? Don't think you can finesse yourself throughout your medical studies without knowing a little bit of the language, okay? Official language of the country is Bulgarian, so most people speak Bulgarian. Yes, the younger generation, they know how to speak English, but you are in a foreign country. You need to try your best to also integrate yourself into the country, integrate yourself into the culture, and do things a bit like Bulgarians. Listen to Bulgarian music, listen to Chalga music, eat Bulgarian food, banitsa, drink Bulgarian wine, eat Bulgarian yogurt, kiselo miyako, okay? So yeah, the language barrier is going to be quite a shock for you, because if you have never lived anywhere apart from, let's say, the UK or Ireland or the USA, and you come to a country where the language is completely just Bulgarian, you don't know how to speak it, you don't know how to read it, you cannot even try to read it if you don't get taught how to read it. Language barrier is also going to play a role when you go into school. Some professors, their accents is different, and some professors, they are not as fluent as you know, as you coming from England, they are not as fluent in English as you. So those are some of the aspects when it comes to, you know, studying medicine in Bulgaria, in a foreign country where the official language is not English. The next thing is going to be cultural adjustment, guys. Adapting to a new way of life, adapting into a new country, and how things are done here, how people move, how people think, how people behave, customer service. You have to adapt into the ways that they do their own things here in Bulgaria, and it's going to be a bit of a shock for you, especially when it comes to customer service. When I was working in the UK, customer service was so huge to us. Like, every boss, every manager, like, they say the clients are first, the clients are first, the clients are first. But here in Bulgaria, no one goes by that rule, baby. No one goes by that rule. So if the shopkeeper feels like she can just dash your groceries like this, she'll do it. If the shop, if for example you go into a restaurant and the waitress decides, no, I don't want to serve those people, she can do it. She will tell her colleague, I'm not going to serve that table. She's going to tell them. Also the music is also part of culture, so they have their own sort of music that they listen to. They listen to Chalga music, okay, and they absolutely love Chalga. They love playing Chalga music in clubs here in Bulgaria. So when you go to the club, your experience is not going to be the same as in the UK, for example, where they play all of these Afrobeat, they play R&B, they play soul, they play all sorts of these types of musics, okay? Some clubs only play Chalga music, and they will play Chalga music every single day. So you need to be aware of those things. One of the downside of being a medical student abroad, you will miss your family. You will miss those people you've always worked with. If you used to have a job, you'll miss your friends, you will miss your family, your sisters, you will miss the environment you grew up in, because it's completely different. Let me tell you, it is completely different to whatever you're used to, okay? Whatever life you used to have there is different here in Bulgaria. You need to be an open person if you want to make sure that your medical education here is like top-notch. Medical experience here is lit. You need to be an open individual so that you can make friends, making friends with international students, also with local students, local Bulgarian students, signing up yourself to maybe a society so that you can meet other students, going to events to meet other students. You have to be open, because if you're closed up and you're just in your house, you're just in your home, you're not hanging out with anyone, it's going to be pretty difficult. Let me tell you, it's going to be pretty difficult for you to have an amazing student experience here in Bulgaria. That's why I'm saying you're going to feel homesick. You're going to be missing your mom and your dad. You're going to be missing especially your mom's cooking. You're going to be missing your home food, the type of food that you used to eat at home. You are going to miss everything, okay? Everything that you used to take for granted when you were home here in Bulgaria, you are going to absolutely miss all of those things. You might get lonely sometimes, you might get sad, you may feel like you want to drop out sometimes as a medical student here abroad, okay? Because of course you don't have people that you know, especially when you're starting in first year. It's going to be a bit tough, but guys, hang in there. You will make friends. Make sure you're open, make sure you are open to meeting other people, and once you meet 2 or 3 friends or just one friend, trust me, your experience is going to change dramatically. It's going to make so much of a difference for you, okay? It can be emotionally challenging for you because you know how to rely on yourself for everything. You have to rely on yourself for your studies, you have to motivate yourself, you have to be the one talking to yourself to go and study, to go to your lectures, to go to your seminars. You have to be the one to pay your bills, to pay your bills. You have to be the one to go for your grocery shopping. Your mom is not there to do the grocery shopping anymore. Your mom is not there to do your laundry. Your mom is not there to cook for you. So you have to do all of these things, and these are some of the down points of studying far away from home, far away from family, far away from an environment that you're used to, far away from the culture that you're used to. It's going to be a bit challenging for the first couple of months, I would say. The next big thing I'm going to mention here is that the education system is different in Bulgaria, okay? The education system here is different compared to the UK. It's not the same. Yes, we are in the European Union, blah blah blah, yeah, but it's not the same. And the way the wards are run here in Bulgaria is different from what you see in the UK, for example. The downside of studying, especially as a medical student, is that we lack practical skills. I'll say it, I'll not hide it, okay? We have the knowledge, but the practical skills of things is lacking. Lacking a bit. Why? Also because of COVID. What happened? You know, 2 years, we lost 2 years of our clinical education because of COVID. So you need to beware when you come to Bulgaria that nothing is going to be, your expectation needs to be lowered down a little bit, and this is what you have signed up for. And you know, you have to eat whatever you're served. You have to eat whatever you're served. And one of the ways in which you combat this lack of practical skills is that you can start working in the UK is by applying for a healthcare support worker job in the NHS, okay? And you can work as a healthcare support worker, or you can work as a healthcare assistant in a care home, okay? Try your best to expose yourself in the environment of caring for those that are unable to care for themselves, because that will help you to build your confidence. It will help you to know how to speak to patients. It will help you to know how to navigate the work environment and how and who to speak to and how to speak to people, how to address people. Of course, those jobs will not give you the skills that you need as a medical student, but once you go, for example, if you have a job in the NHS, okay, as a healthcare support worker, you can find the contacts of the consultants in the wards in which you work in. You can email them and then tell them, okay, can I please come in to work, to do a placement? Can I come in to shadow you? Can I come in to do this? You know, once you have their contact details, during your summer you can go and do placement. Or once you finish your medical education, because we have quite a long time, you know, because we need to get our PIN, we have quite a couple of months. You can do a clinical attachment in these wards that you've worked in, as long as you have their contact details. That's what I'm saying. It's very important that you try your best to cover the lack of practical skills you have. Just by signing up for a job in the UK can put you in a better position compared to someone that has never done anything outside of Bulgaria, okay? This is one of the biggest downside of studying medicine in Bulgaria. Is literally just the clinical aspect of things, the practical aspect of things, because also language barrier plays a role into this, because when you go into the hospital and if you don't know how to speak Bulgarian, how are you going to take history? How will you diagnose the patient? So these are the sort of things that you need to take into consideration when you come to Bulgaria, guys. It is not as much as it's a bit easier to get into medical school here abroad, it's difficult. You have so many other things you need to think about, guys. So that's why I say, if you're a young person, stay back home. Stay back home if you want, if you can. But if you can't, if you feel like, okay, you want to come back home because it's affordable here, and you know this is just the only way for you, then go ahead and come, you know. But otherwise, if you think that you can try again another year in the UK, do try again another year in the UK, guys. But it is not to say that Bulgaria is bad. I've told you guys that there's many good aspects, there's many advantages to studying medicine in Bulgaria. I've shared only advantages so far in my videos. I am sharing with you guys now the disadvantages of studying here, so that you can balance it out and you can see, you know, what you are putting yourself into. Okay, the next thing I'm going to talk about is discrimination, of course, because you might be discriminated against because of your skin tone, because of how you look. People may just call you something as you walk on the street. Don't mind these people that may call out on you, that may say some negative things towards you. Don't pay attention, because you are here for yourself, and you don't want to pay attention to things that people say that are not true concerning you. Just ignore them, walk your way, go past, just act as if they don't exist and walk away. Don't try to combat them, don't try to retaliate and say something back. Like, please do not. Okay, my experience racism. Okay, sometimes in some restaurants some people will not serve you. Some people can choose not to serve you because of what you look like. I'm sorry, that's something I've experienced. And in the street while you walk, some people may utter words that are not right, and you need to try not to listen to those things, guys. That's what I'm saying. It's so important to have a peace within yourself, because if you don't have peace within yourself, you will listen to what these people are saying, you will take it in, you will dwell upon it, and then it's going to create this thing within you that will be hate towards a particular people, and you will think that everyone else in this country acts that way, whereas nah, there are so many lovely, amazing Bulgarians. I've met maybe 1, 3 or 4 that are not very receptive, but honestly everyone else is very, very nice. Everyone else is welcoming. Try your best to do your research before making the decision to come to Bulgaria to study, or any other foreign country, because it comes with its advantages and disadvantages. I know a lot of people don't talk about the disadvantages, but trust me baby, there are some disadvantages of coming to these countries to study medicine. The advantages always outweighs the disadvantages, guys, always. So because if it wasn't the case, I wouldn't be here. I wouldn't still be here after 5 years. So there are so many other students that keep coming back to Bulgaria. I know it's quite a tricky subject to talk about, but I had to balance it out, because quite a few people have also asked me what are the disadvantages of studying here in Bulgaria. And honestly, one of the biggest thing, like I told you guys, is honestly the language barrier. If you don't know a bit of Bulgarian during your clinical years, how are you going to survive? Another thing is the lack of practical skills. We do not have enough practical skills when we graduate here in Bulgaria. Yes, the knowledge is there, but the practical skills is also very important. And I think that's something that maybe our universities here in Bulgaria should start working towards. Maybe implementing OSCEs, maybe implementing like sessions, maybe during the weekend, you know, where students can go ahead and go into the clinics and do quite a lot of manipulation, instead of just taking history, talking to patients and not doing anything else because all the nurses can do it. I know even back home the nurses do a lot of the jobs, but I think it's important that even as doctors we are able to do a couple of manipulations. Just because you're a doctor does not mean that you shouldn't learn how to take blood, you shouldn't know how to insert a cannula, you shouldn't know how to put a catheter, you know, a urinary catheter on a patient, or you know, there are so many things that students are now ignorant of because nurses are trained to do these jobs. But I think it's important that we learn every single aspect of medicine so that we can be practically ready for anything, especially in an emergency situation. But don't be afraid, don't be alarmed, because if I'm here and other people have graduated from here and they are working in the NHS, it means that what we are getting here is not in vain. What we are getting here is the real deal. We can still be able to practice as doctors in the UK. After all, the degree is recognized by the GMC. So in every other universities, even in the UK, there are some downsides studying in those universities. For example, in Scotland, I've met a couple of medical students in Scotland that have also said that actually your experience in Bulgaria is pretty similar to my experience here, you know, everywhere. We have to chase the doctors if we want to do some things, if we want to learn some things. We have to basically like run after them and be asking them this. You have to be willing, you have to be proactive when it comes to your education, guys. No one is going to be serving you on a silver plate, you know, or with a silver spoon. No one is going to be spoon feeding you. If you want to know something, you have to ask for it. You have to be proactive, you have to be willing and showing that will to learn, showing that will to do things. Like for example, right now during my rotation in I'm in my final year and I'm doing my rotation in internal. One of the things that I'm doing is trying to take blood, trying to insert cannulas, trying to do urinary catheters, trying to do all the manipulation that is available on the ward. So I go in the clinics, and when the nurses are going to these patients to take blood or to insert a cannula, I'm like, please let me do it, you know. And then they were like, okay, and then they will just direct you. So you beg them and you ask them, please, can I do it? So once they know that you are proactive and you want to do it, they will let you do these manipulations. Yes, for the first couple of times they will be there to direct you, to show you how to do it, but you know, as you do it, you're going to pick up the pace, guys. So don't leave these things till the end, okay? No matter how different you may believe that the medical education from here and the UK is, some medical students I've encountered in the NHS have told me that our experience is actually pretty similar. The only thing we may be lacking on is honestly that confidence to do or to perform our practical skills. That's it, okay? Because you may know how to do something, but because you've never done it before, you know, you may be shaky, but you know, after doing it a couple of times, I think everything is going to be well, guys. And thanks so much, guys, for watching. I'll see you guys in my next video.